Okay, now coming to the key catabolic elements of the flow phase of the metabolic stress response. We just studied in the previous figure that there are so many metabolic changes, basically the catabolisms happening in the body. Bailey and Love explains almost each and every of these. When with respect to the exam point of view, this part only consists of all by heart stuffs. Okay, so we will only remember what needs to be remembered and then just forget the rest, so that it becomes easy for the final revision. Okay, so under this heading of hypermetabolism, the important question that could be asked is how much is the increase in basal metabolic rate. Hypermetabolism means the basal metabolic rate from the baseline, it increases during the stressful situations, right? So BMR increases by 15 to 25% above the baseline. About the baseline. This is one of the questions that can be asked. Okay, next coming to the proteolysis. Okay, alterations in the skeletal muscle protein metabolism. Basically, skeletal muscle is the main protein reserve in the body. The main protein reserve of the body is the skeletal muscle. Okay, the muscle protein synthesis and breakdown happens at the rate of muscle protein synthesis and breakdown happens at the rate of 1 to 2%, while the liver protein synthesis and breakdown happens at the rate of 10 to 20%, which is much more than that of the muscle. Okay, and the major protein that is concerned with the liver is the albumin. Okay, and one more by heart formula that is given in the Bailey and Love is 1 gram of nitrogen is equivalent to 6.25 grams of protein, which is equivalent to 36 grams of wet weight tissue. Just write it in a sticky note and stick it onto the study table or your wall. Just keep revising this daily. There is no other way you would otherwise remember this, because this is not something that we use in our day-to-day clinical practice. Okay, now we said skeletal muscle is the main protein reserve in the body, right? So one of the questions that gets asked is, which is the predominant amino acid that is produced during skeletal muscle breakdown? There are two actually, that is glutamine and alanine. Glutamine and alanine. Okay, next, the next question that can be asked is that the only muscle which is not broken down during stressful situation, only muscle that is not broken down during stressful situation is the cardiac muscle. Okay, another question which is a reasonable or a logical question is that they ask you that we talk about proteolysis, right? Because there is no other source for glucose, the body starts breaking down the protein that is available in the body. But then by giving more protein rich food, is it possible to stop this proteolysis? So the answer is no. The answer for this question is no, because catabolism cannot be inhibited by hyperalimentation. Okay, this is a direct line from Bailey and Love. Hyperalimentation, that is even if you once the switch button of catabolism is turned on, you cannot inhibit it by any way. Okay, so once the patient is already in the phase of catabolism, you cannot start the total parenteral nutrition and think that giving more and more doses of TPN would bring him out of catabolism. No, that is not going to happen. So only give moderate doses of, like, what is required, just that has to be given. Moderate doses of TPN would be beneficial, but giving higher doses will only cause harm to the patient. Okay, that we will learn further in the chapter of nutrition. Why is it so and how is it so? But just remember, catabolism cannot be inhibited by hyperalimentation. Okay, now coming to this box, provide skeletal muscle wasting provides amino acids for metabolic support of central and organ tissues. It is mediated at a molecular level mainly by the activation of ubiquitin proteasome pathway. This is one important question that is asked, that is, which enzyme pathway is involved in proteolysis, otherwise skeletal muscle breakdown. Okay, now there are actually, this is the most important one. Other than that, there are also few more. One is already we know, ubiquitin proteasome pathway. Second one is the calcium calpain pathway. This is also involved in proteolysis. Okay, and then lysosomal cathepsin pathway. All these are involved in skeletal muscle breakdown, out of which ubiquitin proteasome pathway is the most important. And there is if at all they ask you a question regarding this, the fourth option they would give is the mTOR pathway, which is involved in protein synthesis and not protein breakdown. Okay, mTOR pathway is involved in protein synthesis and not breakdown. Okay, there is one more diagram that has been given in Bailey and Love, which I have not put up here. It is basically the ubiquitin proteasome enzyme complex, the picture of ubiquitin proteasome enzyme complex, which has got 3 enzyme complexes, E1, E2, E3. Not very important, but then just remember, if at all you can remember. Okay, E1 is the activating enzyme, E2 is the conjugating enzyme, and E3 is the ubiquitin ligase. Okay, ubiquitin ligase. Okay, now the next topic is this alterations in the hepatic protein metabolism, the acute phase response, right? The important topic or the important concept here is which are the positive acute phase reactants and the negative acute phase reactants. The most important positive acute phase reactants are C-reactive protein, plasma ceruloplasmin, fibrinogen, right? The negative acute phase proteins, the most important, the very important question is the albumin. Albumin is a negative acute phase protein. Why is it so? That is also an important question. Why is albumin a negative acute phase reactant? That is because of the 3 times increase in the transcapillary excretion rate of proteins. Because during inflammatory conditions, the transcapillary excretion of the proteins, it increases 3 times. That is why the albumin is lost during inflammation. That is why it is when we measure the serum levels of the blood levels of albumin, we find it really low. So it is a negative acute phase reactant. Okay, next coming to the insulin resistance. The important questions are, see, Insulin resistance is one condition that is encountered in the clinical practice also. Like post-operatively, most of the patients, even though not diabetic, they would have a very high blood sugar levels. That is because of the insulin resistance. Okay, so if at all post-op patients, they have high blood sugar level, hyperglycemia, they are managed with insulin. And the question that is asked here is, the post-op insulin resistant, it can persist up to 2 weeks. That's it. Which means that it is a transient insulin resistant. It is not permanent. Once the patient comes out of that stressful situation, once the physiological levels or physiological responses are set back, the glucose level comes back to normal. The second question that gets asked from this topic is that the hyperglycemia that we see in the post-operative period is as a result of so many different things combined. Okay, one is increased glucose production. We said that everything is directed towards glucose production. There is gluconeogenesis, proteolysis, lipolysis, everything contributing to gluconeogenesis, right? So that is one of the reasons for hyperglycemia. Second thing is the decreased entry of glucose into the peripheral tissue, which is called as the insulin resistance. Decreased entry of glucose into peripheral tissues and cells. This is called insulin resistance. Okay, and the third question that could be asked, these are all just direct lines from the paragraphs of Bayesian law. Okay, so the degree of insulin resistance is directly proportional to the magnitude of injury. These were the questions, they used to frame these questions in our mock exams, and they used to ask us. I haven't seen such questions in the previous year recalls actually, but then it's better to know, so that you get a confidence that you have completed line to line from these first 21 chapters, because they are very important. Okay, and one more thing here is that increased glucose level, decreased entry of glucose into peripheral tissues, as well as the pro-inflammatory cytokines. The pro-inflammatory cytokines, they also play a major role in insulin resistance. Okay, these are the expected questions from this topic. Next, moving on to some small topics. Okay, these are some small subheadings which are mentioned in Bayesian law. Changes in the body composition following injury. Okay, catabolism leads to a decrease in the fat mass and skeletal muscle mass. This is true, right? When you see a patient who has suffered a major trauma, or who has just come out of a major surgery, you realize that the person has lost the fat from his body, and once the fat is lost, then the next source of glucose would be the protein, right? Protein, the skeletal muscle mass is also lost. The patient becomes very lean and cachexic, correct? And the body weight may paradoxically increase because of expansion of the extracellular fluid space. There might be fluid retention in the body. There could be whatever the body weight, if at all it has increased, would be because of edema and not because of weight gain actually. Okay, this figure actually represents the same. The entire body mass is made up of fat, protein, the intracellular water, the extracellular water, minerals, everything, right? Once you remove the fat from the body, okay, once the fat from the body is lost, whatever remains is the free fat free mass, or the lean body mass, correct? Now, next the next summary box from Bayesian law is this: avoidable factors that compound the response to injury. Again, not really a very important topic, but then logically can be remembered easily. That is, what are the things which are responsible, what are the things that contribute to injury and at the same time can be avoided by us, right? One is continuing hemorrhage. We can stop the hemorrhage by giving compressions, or by uh, by whatever it takes to stop the bleeding. You can do it, right? Hypothermia, definitely you can warm the patients. There are different ways of avoiding hypothermia, right? Then tissue edema, tissue under perfusion, these are also the things that can be avoided. Basically you have to give IV fluids in under limit, right? Not too much, not too less, right? Then starvation also, early feeding of the patient, be it orally, be it orally or parenterally. And then immobility also can be avoided. You make the patient mobilize as early as possible, correct? These are the things that can be avoided, so that the response to injury is not compounded or exaggerated, correct? That this exactly is the basis for the next topic, that is enhanced recovery after surgery, ERAS. This is one of the important short topics for short question for MS final year exam also. Okay, so the enhanced recovery after surgery, again this is very logical. Minimal access techniques are followed now. Minimally invasive surgery or the laparoscopic surgeries are followed, so that patient can be discharged at the earliest from the hospital, right? Then blockade of efferent pain stimuli, giving epidural analgesia, spinal analgesia, or the wound catheters, so that the postoperative pain is less. Once the pain is less, the patient gets mobilized early, he can eat early, he can be discharged early, right? Then minimal periods of starvation preoperatively. Even preoperatively, the duration of for which the patient is kept nil per oral has been reduced now. That is also one of the important questions which will come under the nutrition chapter, but then that is one of the components of ERAS, right? Then of course early mobilization, as early as possible the patient has to be mobilized. Also there are few other points, like nowadays we don't prefer, certain surgeons don't prefer giving bowel wash before GI surgeries, right? That causes sodium and potassium. Patient would have lot of diarrhea before the surgery, that which will lead to sodium and potassium imbalance just before surgery, which can in turn result in post-op ILS. That is what is believed. Okay, then yeah, that's all from the first chapter, metabolic response to injury. This is the PDF that I had made for myself, and just this was it for the last minute revision, nothing more, nothing less. Okay, maybe maybe you also find useful. Thank you.